Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I have about 33 years of clinical practice, and today we're working on torticollis. So in torticollis is where your child's head is tilted to one side and rotated to the other side. In this video, we're working on left torticollis. Torticollis is described as which way you tilt the head. You actually rotate the head the opposite way. So on left side of torticollis, you tilt your head to the left and rotate it to the right, because this muscle right here, the sternocleidomastoid, I can make it tight right there, it sticks out, it gets tight. So you need to work on things that make them tilt their head to the right and rotate left. Let's talk about the importance of aggressive repositioning. So one of the things that you can do, you look at your day and see all the ways that you work with a baby and play with a baby and feed a baby and change it. So one of the easiest things you can do is start working on how you feed it. So the baby, if he has left-sided torticollis, his head turns to the right, you want to feed him so that he turns his head to the left. So right here you can see Bodhi, my co-instructor. His head is being turned to the left as Bodhi is feeding. So this is a perfect way to work on. Now, in typical development, you'd want to change sides. But since Bodhi, if he had torticollis, he doesn't. But if he had left-sided torticollis, you want to feed him primarily with his head turned to the left. So this is the first of the aggressive repositioning plans. This is another option for aggressive repositioning and feeding. If you cross your right leg over, and you can have him look to the left, and that would work well for left-sided torticollis, because those children want to tilt left, look right. So here we're having him look to the left to be able to feed. Now, in terms of bed positioning for a child who has left-sided torticollis, these kids tend to tilt toward their left side and look to their right. So you want to make sure that when they're in their bed to go to sleep at night, that the room is out to the left to encourage them to look to the left. And when you lay them down for the night, you want to go ahead and turn their head to the left before you leave them for the night. For left-sided torticollis, you want to make sure you put him on the changing table so that he has to look, thank you, to his left to be able to see the world. So his head to your right on the changing table, looking out to the left. So in the car seat, you want to, if a child has a left torticollis and their head tilts off to the left, such as Bodhi's demonstrating right here so perfectly, one of the things you can do is get a towel roll, tilt their head the opposite direction, and block them. What they say when you do this, I've seen them also do it where it goes over the top of their head, that you want to do it only when the child is supervised, because you don't want this to fall down and possibly choke your baby. So only in a car seat do you want to do this when they're supervised. But you can use towel rolls to help tilt their head the opposite way. The last thing to think about with aggressive repositioning is to significantly limit container. So when you think about containers with babies, that's like car seats or bouncy seats or rockers or swings, particularly car seats. Certainly you can use a car seat when the baby's in the car, or if you're in the grocery store and have the baby in the car seat. But other than that, you're supposed to limit car seat use to 15 minutes a day, and significantly limit the times in the rockers and the bouncers and the swings. Because in those positions, for children who have either right side or left side torticollis, it really is a position that encourages that asymmetrical posturing of the head and neck. I hope this video talking about aggressive repositioning is helpful for you. Bodhi's asleep now, so imagine him saying bye with me. Bye, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.